right, so we finished with chemo. Now we prepping for surgery. What are my breast surgery options, and what did I do to prep for surgery? Hey everyone, I hope you are having a good day. Welcome back to my channel. For those of you who are new, welcome. This is Living with Purpose, Rosena's story. So we completed chemo. We repeated the scans just to compare with the previous scans. Now, the next phase of the treatment is surgery. So I will tell you in a few minutes on what I had to do to prep for surgery. What is the procedure? So for those of you who don't know, I did went for treatment through MD Anderson. Every facility is different and every cancer patient is different. For my type of breast cancer and for the size of my tumor, that was my plan. Chemotherapy first and then surgery. Let's talk about it. But prior to surgery, there's a lot I have to do to get ready. There's a lot of things they look into when deciding what type of breast surgery you need to do, when you need to do breast surgery, when to do chemo, when to do radiation, if you need radiation, if you need surgery, all of that. There's so many factors in that plays. All right. So for me, I had triple negative and my tumor was huge. It was taken all over my breast. So I went to see my breast surgeon. So I have a breast surgeon. I have a plastic surgeon. The breast surgeon, I went to see her. So she kind of just gave me a breakdown of what she will do on the day of surgery and who will be with her. So her PA will be with her, and her job is to remove all the breasts depending on what. Let's fix that. Her job is to remove the tumor or the basin of the tumor. Now, in some cases, they will remove the whole breast. So that's why I will tell you the different type of surgeries that are available for breast cancer patients. So she explained that to me. For the surgeries, you can do a lumpectomy. And a lumpectomy is where they go in, they remove the tumor itself, and you are saving some of your breast tissue. And you can choose to do reconstruction with implants, or they just give you a lift or put more tissue in there, whatever the case, okay? But at least in lumpectomy, you still have breast tissue. A mastectomy, you can do a complete mastectomy or you can do a partial mastectomy. If you do a complete mastectomy, they remove everything to the chest muscle and you remain flat, okay? If you are planning on doing reconstruction, you will do a mastectomy. However, there's a certain way they have to do the surgery to make sure when you do the reconstruction, there won't be any issues. Also, they have skin sparing mastectomy. The skin sparing, they will keep your breast skin. They just go in, they remove all the breast tissue, okay, from the skin, like the breast tissue all the way to the skin, but they keep the skin, okay? So that way, when you do reconstruction, they will use the skin as a pocket to put tissue fat, or whatever the case, so they can form a new breast. What was my option? For me, I chose to remove the whole breast. I didn't want to take any risk. I didn't want to take any chances. Just because my tumor was huge, it had taken all over my breast. So I did a complete mastectomy with reconstruction. However, my surgeon suggested for me to do reconstruction after radiation. So that's what I did. Also, another option you have is, well, not option per se. So let's say your tumor was local. It didn't move from its place. It didn't go anywhere else. Your lymph nodes were not involved. Then they won't have to worry about the lymph nodes around your breast area, your chest wall, or your axillary, your underarm, your armpits, we call it. For me, I had about 2 or 3 lymph nodes involvement. So I chose to go to remove all the lymph nodes under my axillary, under my armpits, just because when I spoke to my breast surgeon, when I asked her, how would she know which lymph node to remove? She said she doesn't know. They'll just go in there, they'll remove 2 or 3 if that's what I want, and then they will put it in the lab to see if he has cancer. Now, I said, you know what, that's taking a big risk. Because there's a 50-50 chance that the lymph node they remove is not the one that had cancer. So I went ahead and told her, just remove everything. So I did, at the end, there were at least 20 lymph nodes that were removed. So, and I will talk about that on another video. Anyway, so the breast surgeon explained all of that to me. We signed consent, we give consent for them to do surgery, and then we plan on a surgery date. Then I had another appointment with plastic surgeon. Plastic surgeon, their job is to explain to you the different options you have when it's time for reconstruction. All right, so because I was doing reconstruction with a complete mastectomy with lymph node involvement, I had the option either to do implants or to do what they call a deep flap. I will explain that on another video. So, she went into details on how the reconstruction works. I didn't want implants, so I chose to do the deep flap, which is transferring of tissue and fat from any part of your body. It could be mainly your abdomen area, and then sometimes the side of your arm, on your back. They will transfer those doing surgery, which is the plastic surgeon job. That's what they do. And then they will form new breasts. That's what I chose to do. But that will be after radiation. And I did choose to also do a double mastectomy. But currently, I only did, to begin with, I just did one unilateral mastectomy, which is on the side that was affected, where the tumor was. Then, after she went into detail, explained everything to me, she didn't want me to do reconstruction or have implants prior to radiation because radiation causes a lot of damage. It damaged the tissue, it damaged the skin. Once it's damaged, you have to wait for it to heal before you do reconstruction. So she didn't want me to have problems later on. So she said the best option for me is to just wait after radiation. So that's what I did. So they explain all of that to you. She tells me, how much weight maybe I have to lose because I did gain some weight doing chemotherapy. So how much weight I have to lose, how much fat she will need. So if I do lose weight, I have to think about how much weight I'm going to lose because she will need those fat in order for her to do reconstruction. She explained all of that. And then she also go into details of how long the surgery will be. So after she explained all of that to you, then you have to sign everything. Then they start scheduling some other scans and also scheduling the date for surgery. So the next thing I had to do was scans to prepare to make sure my body's ready. Especially, after undergoing chemotherapy, they have to make sure my blood works is normal, my kidneys are functioning well, liver and everything. That's about it. Once we're done talking to all these people, they tell you how things will go. And then now we just wait for our body to recover a little bit after chemo, and then we prepare for surgery. I just wanted to come on here and let you know, just give you updates. Thank you for tuning in. And please don't forget to help me share my story by hitting that like button and subscribing. Thanks for watching. I will see you in the next video. And remember, enjoy the little things. Bye.